Hi viewers, welcome back. In today's video, we are going to discuss about induction of labor. Okay. So, in the previous classes, we have seen what are the symptoms for a normal labor, when do you term it as a normal labor, and the physiology of first stage of labor. So, now we have learned the labor has to get initiated by itself and it has to get terminated by itself. In case if this does not happen, you term it as abnormal labor. Okay, now, so now the labor has not initiated by itself and we are supposed to induce, that is like you are supposed to help the mother to deliver the baby. So, now we will see what are the methods available to induce labor. Okay. So, now I will just tell you like when you go to police station, you will have a board telling that these are the thefts and like these are the crimes you are not supposed to do. Likewise, there are some methods like what in olden methods or like in olden tradition they had followed, that is like illiterate people, untrained dice and like people like who were inducing abortion and all these illegal methods were followed. Okay. So, I will tell you there are some methods which were very unsuccessful in inducing labor. Okay. Maybe you will come across all these incidents, but you have to understand that these are wrong methods. So, unless and until you know something is wrong, you will not realize what is right. Likewise, now let us discuss what are these unsuccessful methods which is available for inducing labor. See, again I will tell you these were all olden methods which they were practicing and which was unsuccessful in conducting delivery. Okay. And like either it was like prolonged labor or otherwise PPH, it led to death of fetus as well as to the mother. So, you had lot of complication when we presented with all these induction of labor methods. Okay. So, now we will see what are these dangerous or the historical methods of inducing labor. Okay. So, the first method of induction is the massage of the breast and uterus. Okay. See, actually massaging of breast and uterus even now we follow, but that is not the only method that we practice when we induce labor. Okay. We give drugs, we follow some other techniques. Okay. All these like induction methods we do, and then only we are like helping, that is like either you massage the breast or the uterus to induce labor. Okay. So, only this was the only method that was followed. So, that is like only breast massage and the uterine massage causes stimulation of the uterus. So, it produces oxytocin, that is like for the contraction. So, it was helping to produce contraction that was inducing labor. But just imagine, just a contraction, how long it will stay? Whether it will stay till the first like full second stage and till the third stage? No, it will stop in between. And what will happen? There will not be an adequate contraction to expel the fetus as well as the expulsion of placenta and membranes. So, that was an incorrect method, that is like where they were practicing and it was unsuccessful in conducting the delivery of fetus and the placenta and its membranes. Okay. So, the next method we have naked moon dance. Okay. So, you may wonder whether this was practiced. Yes. So, it was like the term, as the term says, the women, they were used to allow the women with like nakedly they used to practice dancing methods. Dancing method in the sense maybe they are trying to stimulate exercises or like mild techniques like which may cause stimulation, thereby they are inducing conduction. See, what is going to happen? Maybe there will be mild contraction, but again it will not be definitely effective in delivering the baby. And then comes the use of herbals. Even till today, interior villages and not only in India, China, Japan, and like many countries, Africa, these countries, the interior people, they are practicing this method, that is like use of herbals. They consider some, like even some foods, like we consider it as hot foods, cold foods, some foods like gas forming foods, we can divide all these type of foods. Similarly, there are herbs which are able to like induce contractions. Okay, so what they will do, so when you consume these herbs, like either like you have to eat it raw, or otherwise you boil it, give it as a kashayam or syrup, like that they used to give. So however they give, they caused induction of labor, they used to cause stimulation of the uterus, thereby inducing labor. Again, this will not be effective for the full stage, so that is till the completion of second stage of labor, it may not be effective. And then coming to the stretching of the cervix digitally. So even now we follow this stretching of cervix digitally. So like already I have said you, when you are inducing labor, how you give your drugs for induction. Similarly, we do stripping of membranes. Okay, stripping of membranes is nothing but you are like the membranes, you are separating the membranes from the cervix and you are helping in the conduction, that is like contractions to take place effectively. So what it is like, when you strip, there are like there is a stimulation in the uterus, so which is going to secrete oxytocin, that is going to help in the delivery of the baby. But this is not the only method. Okay, you can't do any of these things alone to induce labor, to conduct the labor and to finish labor. Okay, so anything, it has to be done constantly. Okay, so this is again only when you are doing stripping, that is not going to cause effective contractions which is required to deliver the baby. Okay, so then the next point is like use of rubber tubing. Again, just imagine just a use of a rubber tubing. What does this tubing is going to do? You introduce something artificially into the cervix of the women, that is going to cause stimulation. So when there is a stimulation, there may be a contraction induced, and because of that. Then coming to hot carbolic acid douche. Okay, so this is similar like your enema. So what they are going to do is like enema, you know that it is like you are going to flush it in the anal region. So douche is like you are going to give it in the vaginal douche you can give. But what they are going to do, again they are going to cause stimulation of the uterus. See, like usually what we do for an mother, for an antenatal mother, before 38 weeks of gestation, we don't encourage enema. The reason is like once they start with the abdominal movements, the peristaltic movement increases, there may be a contraction stimulated, the women can go in for delivery. That is the reason we don't encourage enema for these antenatal mothers. But once you are planning to terminate the pregnancy, once you are planning to induce labor, you encourage enema, you give enema. Okay, so you either you go in for soap water enema, or otherwise like a mild just a water enema, that will be sufficient. So this is like carbolic acid they were using to stimulate. So what happens? Stimulation of contraction. So contractions they were induced, but again it is not sufficient. Okay, then coming to the next method of rupture of 4 waters. So already again you can remember in the previous classes, like we were using, that is like during your first stage, physiology of first stage, rupturing of membrane is a physiology. Okay, there will be rupture of the Hind, like 4 waters we will be doing. Okay, so when there is a bag of water form, you will be holding the tissues and you will rupture. So there will be a mild leak of the amniotic fluid and the labor will be initiated. So you will have a proceeding in the labor will get initiated and it will proceed very fast. That is the reason we are doing to rupture the membranes. But in olden days only that was the method. Okay, so that was again it was not successful. And then coming to hind water rupture, where hind water rupture in the sense what we are doing clinically is the 4 water rupture. 4 water in the sense that is the bag which is in front of the cervix. Okay, so that is like as soon as you enter the cervix, you are going to see this lower region, that is your fore waters, like where you are going to give a mild break and the rupture of the membrane is going to take place. But this hind water, in the sense, you are going to break the full sac. So what will happen? The full sac will break and there will be sudden decompression of the uterus. So what will happen? Suddenly the baby will go in for asphyxia, or otherwise even the mother, sudden amniotic fluid loss will cause hypovolemic shock for the mother. So it will cause lot of complications. So all these were illegal and unsuccessful methods in induction of labor in olden days, but now also in interior region and in the tribal regions they are following, which are very dangerous method. Okay. So now I have said you what is wrong, and in the next class we will decide what is right. Okay. So next class we will talk about induction methods which is available in our clinical area, which are very successful in inducing labor and the delivery of the baby. So until then, take care. Bye.